Hi, how are you today?
Good.
Wonderful. My name is Logan. I'm a nursing student. I'll be performing a musculoskeletal assessment on you today, okay?
Okay.
Can you please just state your first and last name and your date of birth?
Alex Ballman, 10/30/1998.
Wonderful, Alex. How are you feeling today?
Perfect. Thank
Fantastic. Do you have any allergies I need to be aware of?
you. No allergies.
Perfect. So like I said, I'll be performing a musculoskeletal assessment on you today. I'll be having you move. I'll be touching different parts of your body. I'll be inspecting your body, and then I'll be testing the strength of your muscles. Is that something that you're consent to today?
Yeah.
Wonderful. And if I hurt you or I'm causing you any discomfort or pain anytime, just let me know, okay?
Sounds good.
Wonderful. My general assessment of my patient is she is sitting upright. She seems to be her stated age. She seems to be cognitively with it. No signs of like pain or discomfort. No heavy breathing, no twitching or fidgeting. She seems to be calm, cool, collected, and happy to be here. Moving on to my subjective questions. All right, Alex, so have you ever been admitted to the hospital or seen a doctor for any like bone breaks or muscle issues?
No, actually no.
No? Fantastic. Do you exercise regularly?
I do.
How
Quite
often?
Like 7 days a week.
7 days a week? Perfect. And strength training, cardiovascular movements?
All the above.
All the above?
Yeah.
Fantastic. Do you have a past medical history? So does like your family have a history of any bone or muscle degenerative diseases like multiple sclerosis, osteoporosis?
Yes, multiple sclerosis.
Okay.
My grandma has MS.
Your grandma has MS?
Mhm.
Okay, wonderful. On your mother or father's side?
My mom's side, sorry. Maternal grandma.
Fantastic.
Yeah.
And then are you experiencing any pain or discomfort at all right now, currently sitting?
No.
No?
Yeah.
Do you experience any pain or discomfort doing any of your daily activities? Like brushing your teeth, going to the bathroom,
Nope.
getting up and down from your bed, getting in
Absolutely
your
not.
car? Fantastic.
Mm-hmm.
Seems to be nice and healthy. All right, perfect. And we'll begin our assessment.
Mhm.
So, I'm going to first check the range of your motion of your neck and make sure there's no pain or discomfort. I'm just going to assess the neck itself, and I'm not seeing any abnormalities, no excess muscle growth, so equal bilateral both sides, no erythema, no scarring, no ecchymosis. All right, Alex, so I'm going to move my neck, and I want you to move your neck following me, okay? So we're going to move our right ear to our right shoulder, left ear to left shoulder. Any pain?
No pain.
Drop your chin to your chest. Any pain?
No pain.
I'll go all the way up to the sky. No pain?
No pain.
I'm going to have you look over your right shoulder. Look over your left shoulder. Any pain?
No pain.
No, fantastic. And then just one nice little roll from your chin to the back and back down. Any pain?
No
Can you
pain.
go the other direction for me?
Yeah.
And fabulous. Her neck seems to be healthy, range of motion. Now we're going to move on to your shoulders and to your spine. Her shoulders are a little rounded forward, so it looks like a little protraction. Alex, you're going to roll your shoulders back and sit up nice and straight for me. Thank you very much. So now her shoulders are in nice alignment, equal muscle development on both sides. The spinous processes on the back are even and equal. Muscle growth through the erector spinae group seem to be nice and equal, both sides. Perfect. Any pain when I palpate
No
at
pain.
all? No pain at all?
Nope.
Any pain when I press on your shoulders back here?
No pain.
No pain? Perfect. Her scapula seem to be nice and even, both sides. I'm not seeing any signs of any scarring, no erythema, no edema in the shoulders. They look nice and healthy. Anteriorly, I'm going to touch your arms so we know if there's any pain.
No pain at all.
No pain? Perfect. I'm not seeing any scarring, no bruising. Check for bursitis on the elbows. Some scarring here on the elbows, probably from wrecking as a kid, I'm assuming.
Yes.
Wonderful. Her hands look nice and healthy. No scarring. Looks like a little bit of growth on this joint right here, so a little bit of It feels like a tendinous mass, doesn't necessarily feel any pain when I press on this here. No, it doesn't feel like there's any rheumatoid arthritis or anything like that in her hands. All right, Alex, so again, I'm gonna have you copy the motions that I do. So I want you to bring your shoulders to your ears. Elevation, good. Depression, good. And I'm gonna have you reach your arms overhead. Shoulder flexion, good. And then reach your arms all the way back. Extension, good. Now I'm gonna have you reach your arms all the way up to your side. Abduction, good. And bring your arms all the way in. Adduction, good. Now I'm gonna have you do some circles with your shoulders, please. In the other direction. And circumduction is good. Range of motion on both shoulders, equal bilateral, 5 out of 5. Now we're going to do the range of motion of your arms. So I would like you to flex your arms all the way in. Elbow flexion, good. Elbow extension, good. Now I'm going to have you start your hands face down, please. Pronation, good. Then flip them over. Supination, good. I'm going to have you extend your wrists, flex your wrists, and then radial deviation, good. Ulnar deviation, perfect. And then make a fist. Extend your fingers out. And flexion, extension of the hands and wrists are good. Relax back down. I am going to now do some muscle tests on you to make sure that everything is strong and healthy. So I'm going to have you bring your arms up, and I'll press your arms into my hands. Good, flexion's good. Extension's good. I am going to have you put your hands at your side here. And bring your arms out. Just push your arms out against my hand. Perfect. Push them in. Good. External, internal rotation's good. I'm going to have you bring your arms in like this, so resist me, so push into my hands. Okay, elbow flexion's good, and then push down. Elbow extension is good, fantastic. I am going to check your wrist, so try to lift up your wrists. Perfect, push your wrist down in my hand. Wrist flexion and extension is good. I'm going to have you resist so spread your fingers against mine. Good. 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 Last but not least. Good. Finger extension is good. Strength is good on shoulders, elbows, wrists. Muscle test 5 out of 5 on the upper extremities. Spinal cord is in alignment. Now we're going to move on to your lower extremities. All right, Al. I am going to have you, since my patient is able to stand, I'm going to have her stand up. So if you could stand up right here for me, please. Yeah. I want you to bring, right here, fabulous. I'm going to have you bring your right knee up, flexion good, left knee up. Any pain, any discomfort? No. I want you to extend your leg back, please. Other leg. Any pain on extension?
No pain.
No. Let's abduct and then adduct. Good job. Switch legs. Abduct and adduct. Fantastic. Hips. Range of motion seems to be good. I'm not seeing any signs of erythema, some light scarring, no signs of edema, no contusions. She seems to be balanced on both of her feet, no extra inversion or eversion. The knees aren't varus or valgus, they're nice in alignment with the rest. Her hips, on the iliac crest, her hips are nice and equal, on both sides, so equal bilateral. All right, Alex, I'm gonna have you sit back down again for me, please.
Yeah.
All right, so I'm gonna have you bend your knee and then extend your knee out. Nice, so flexion, extension of the knee is good. Do this on this leg. Extension, flexion, good. I'm gonna have you bring your toes up towards your nose. Great. Dorsal flexion is good. And back down. Plantar flexion. Bring your toes into your body. Inversion is good. Bring your toes out. Eversion is good. I want you to bring your knees together. Internal rotation of the hips are good. And then bring your knees out. External rotation of the hips are good. It seems that her range of motion of her lower extremities are age appropriate. There was no pain or discomfort doing any of those movements. Fantastic. So now we're going to do some muscle testing. Okay, Al? I'm going to put my hands on your hips. I want you to try to raise both your legs, or we'll do one at a time.
Okay.
So try to lift up your knee. Perfect. Flexion's good. Bring your knee down. Extension's good. Bring your knee up. Flexion's good. And So flexion and extension, strength on the legs, equal bilateral. Push your knees, bring your legs out. Oh, external rotation, good. Internal rotation, good. Seems like her hips are 5 out of 5, both sides. Now we're gonna move to the knee. So I want you to bring your heel to your butt. Flexion of the knee is good. Now extend your leg out. Extension nice and good. Flexion's good. And extension's good. Fantastic, Al. Now we're gonna move down. Your knees nice and healthy, 5 out of 5. Nice equal movement and strength on both sides. And now we're gonna do your feet. So push up, perfect. Dorsiflexion's good. Plantar flexion's good. Dorsiflexion's good. Plantar flexion's good. Push your foot on the inside. Inversion's good. Eversion's good. Inversion's good. Eversion's good. 5 out of 5 strength testing of the lower extremities. Fantastic, Alex. Do you have any questions for me today?
No questions.
No? Wonderful. Thank you so much for your time, and I'll see you shortly.
Thank you.